Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP, and today we are going to talk about Spravato, also known by its generic name esketamine. This is a comprehensive deep dive into everything you need to know. This lesson is for PMHNP students, psychiatric providers, and clinic staff who want to understand Spravato in a simple, practical, and clinically useful way. We'll cover the science, the safety, and the clinical workflow. By the end of this video, you should be able to explain what Spravato is, who it is for, how it is dosed, and how it is administered in a clinical setting according to the latest standards. You will also learn why REMS monitoring matters, what safety concerns to watch for, and how to educate your patients in plain language to ensure the best possible outcomes. Short disclaimer: this video is for education only. It is not medical advice, diagnosis, or treatment. Always consult clinical guidelines and the prescribing information for specific patient care. Spravato is a controlled medication and must be administered only in a certified healthcare setting under direct supervision. Patients must be monitored by a healthcare professional after each treatment. If a patient has severe sedation, breathing problems, chest pain, severe confusion, suicidal thoughts, severe blood pressure elevation, or feels unsafe, seek emergency help right away. Safety is our top priority. What is Spravato? Spravato is the brand name for esketamine nasal spray. It is a prescription nasal spray used in adults for certain types of depression that haven't responded to traditional treatments. According to the prescribing information, Spravato is used for adults with treatment-resistant depression, also called TRD, and for depressive symptoms in adults with major depressive disorder with acute suicidal ideation. A simple way to explain Spravato is this. Spravato is a nasal spray treatment for certain serious depression cases, when regular depression treatment is not enough, or when urgent depressive symptoms need close care. Think of depression like a room where the lights are dimmed and the doors feel stuck. Traditional antidepressants often work slowly through serotonin, norepinephrine, or dopamine pathways over many weeks. Spravato works differently. It affects the glutamate system, which is one of the brain's major communication systems. It targets receptors that traditional meds simply don't reach in the same way. If traditional antidepressants are like slowly adjusting the thermostat, Spravato is more like trying to reset part of the brain's circuit breaker to get things moving again more effectively. Treatment-resistant depression means the patient has tried adequate depression treatment, but symptoms continue. It's a different approach for when standard treatment hasn't improved things enough for the patient. Important teaching point: Spravato does not remove the need for hospitalization if clinically warranted. If a patient is unsafe or actively suicidal, we still think about crisis stabilization and immediate emergency care. Spravato is not a take-home nasal spray. It is not self-administered at home. It is not approved as an anesthetic agent, and it is certainly not a casual or unsupervised quick fix. Spravato is a Schedule III controlled substance. It is not a drive-through depression spray. It is like a supervised medical procedure with a rigorous checklist and essential safety rules. It affects the brain's glutamate system, especially through NMDA receptor-related pathways. The goal is to influence brain signaling, neuroplasticity, and mood-related circuits to help them heal. Imagine the depressed brain as a snow trail, where the same sad path keeps getting walked over and over. Spravato may help soften the snow so the brain can start making a brand new path. Each single-use nasal spray device contains 28 milligrams of Spravato, delivered as 2 sprays, 1 spray in each nostril. One device equals exactly 28 milligrams of the medication. Common dose strengths are 56 milligrams, which uses 2 devices, and 84 milligrams, which uses 3 devices. Think of each device like a mini-dose building block for the treatment plan. Weeks 1 to 4 is the induction phase, given 2 times per week. Induction is like jump-starting a car battery. The visits are more frequent to get initial treatment momentum. Weeks 5 to 8 is once per week for maintenance. From week 9 and beyond, it may be once weekly or every 2 weeks, based on clinical judgment and the specific patient response. For adults with MDSI, the dosing is 84 milligrams twice per week for 4 weeks. After these 4 weeks, therapeutic benefit should be evaluated to determine if continued treatment is truly needed. Prescription should clearly include dose strength, number of devices, frequency, and the critical requirement for direct healthcare provider supervision in a certified setting. Spravato is stored at room temperature and must stay in the certified setting. It is not a grab-it-and-go medication. Store it, supervise it, and document every single spray properly. Before administration, patients must avoid food for at least 2 hours and liquids for at least 30 minutes. It's like an airport checklist that must be completed before takeoff, step by step. Confirm the number of devices, 2 for 56 milligrams, 3 for 84 milligrams. Have the patient blow their nose once, and then recline their head back at a 45-degree angle. The patient sprays once into each nostril, closes the other side, and gently sniffs. Wait 5 minutes after each device before using the next. Think of each device like a separate chapter. Spravato is only available through the Spravato REMS program due to risks like sedation and dissociation. REMS is like the seatbelt and airbags. It's the safety gate around the whole treatment. Patients must be monitored for at least 2 hours after administration. They shouldn't leave until assessed as clinically stable. Remember, don't let them drive home while the ride is still moving. Remember the SDRAS checklist: sedation, dissociation, respiratory depression, abuse risk, and suicide risk. These are the boxed warnings that we must monitor closely during every session. Dissociation means patients may feel detached from their body or reality. They might say they feel floaty, disconnected, or like things look different. Continuous monitoring is absolutely key. Spravato can increase blood pressure. It steps on the BP gas pedal, so we assess before and after treatment. Always check for a history of aneurysms or uncontrolled hypertension first. Monitor respiratory status. Be careful with other CNS depressants like benzos, opioids, or alcohol. Stacking sedatives is like stacking heavy blankets over a breathing system. It can be dangerous. Assess for abuse and misuse potential, including substance use history. A history of disorder doesn't mean never, but the risk-benefit decision must be very thoughtful and well documented. Patients should not drive until the next day after restful sleep. No driving, no heavy machinery, and no major decisions or signing important legal documents that day. Rest is the goal. Common reactions include dissociation, dizziness, nausea, and sedation. It can feel like briefly wearing virtual reality goggles, which is exactly why our professional monitoring matters. Spravato is not recommended during pregnancy or breastfeeding. For special populations like the elderly or those with hepatic impairment, we drive the treatment bus even more carefully. Patient selection is vital. Screen for bipolar disorder to avoid mood switching. Know the diagnosis, know the specific risk, and always confirm they have a safe ride home. Every session starts like a pilot's checklist. We check the runway before takeoff, fasting status, any new meds, baseline blood pressure, and who is driving them home. No exceptions. Discharge instruction. Today, your only job is to get home safely and rest. No driving, no alcohol, and make sure you follow the next appointment plan we've laid out for you. Explain it simply. Spravato is a supervised clinic treatment for serious depression. We monitor you for at least 2 hours for your safety. It's a monitored treatment with guardrails. Remember SPRAY, supervised setting, patient self-administers, REMS required, assess BP and alertness, and you need a ride home. Spravato is truly a team sport. Seek urgent help for severe sedation, trouble breathing, chest pain, or loss of consciousness. If the patient is unstable, this is an emergency. Escalate care immediately to the right team. Spravato is a valuable option when used with supervision and safety. Text 832-9916516 for support. Subscribe to our channel and join our mentorship family today. Thank you for watching and take care.